Thyroid conditions. This DVD is going to give you information on the latest ways and alternative ways to treat your thyroid conditions and the symptoms that go along with it and how you're feeling. My name is Dr. Sean Chaudhary, a board-certified chiropractic neurologist, diplomate of the American Chiropractic Neurology Board, a fellow of the American College of Functional Neurology, the author of The Secret to Why Your Medicines Didn't Work, The Recovery Way to Health, and The Weight Loss Edge. All chronic health conditions have a common thread. Thyroid conditions, insulin resistance, metabolic syndrome, fibromyalgia, vertigo, sciatica, chronic fatigue, peripheral neuropathy, rheumatoid, chronic neck and back pain, stenosis, irritable bowel, Crohn's disease, celiac, PCOS, ADD, ADHD, migraines, and chronic headaches. Now, there's also the part that goes with those of what the dysfunction are, and the dysfunctions usually go like this: oxygen deficits, neurologic misfiring, metabolic imbalances, blood sugar, dysglycemia, cortisol imbalances, hormone imbalances, anemia, autoimmune attacks, immune imbalances, food sensitivities, and brain imbalances. And we're going to break some of those down as we go through this. The thyroid is a butterfly-shaped gland right below the cricoid cartilage. You have a right thyroid gland and a left thyroid gland. And of course, you can get cysts on your thyroid. You can get a goiter where your neck expands as well. So some common thyroid symptoms are as such: fatigue, increased weight gain, morning headaches, depression, constipation, overly sensitive to cold weather, poor circulation, muscle cramps, catch colds and other viral bacterial problems easily, wound heals slowly, might need excessive sleep, or might have a hard time falling asleep or staying asleep, chronic digestive problems, itchy dry skin, dry or brittle hair falls out easily, edema, especially facial, mixed edema, loss of the outer portions of your eye, outer portions of eyebrows, and of course you can lose your regular hair, right? So we know that you can get that fatigue, weight gain even with a low-calorie diet. We have that morning headache, that depression, that constipation, cold weather sensitivity, poor circulation, muscle cramps even while at rest, getting sick, and of course poor wound healing, of course needing sleep, bloating, gas, constipation, diarrhea, acid reflux, itchy dry skin, dry brittle hair, losing hair, edema. The thyroid gland supports bone metabolism, immune system, brain and nervous system, endocrine system, gastrointestinal function, liver and gallbladder, growth and sex hormones, fat burning, insulin glucose metabolism, healthy cholesterol levels, and proper stomach acid. Every cell in your body has a thyroid receptor site. So we have the bone metabolism, the immune system, the thyroid supports the brain, the thyroid supports the nervous system, the thyroid supports the endocrine system. It goes from basically from chew to poo. That's what the thyroid gland helps with. Thyroid gland supports the liver and the gallbladder. Yes, you need your gallbladder. You have no spare parts. The thyroid supports growth and sex hormones as well. Thyroid supports fat burning. Thyroid supports insulin and glucose metabolism, healthy cholesterol, proper stomach acid, crosstalk. And so the problem is that a lot of times when you go to your doctor and they test you, most of the time your thyroid levels are normal, but you still basically feel like crap most of the time, right? So the problem is that lab ranges, they go on a bell curve, all right? And so when you go on a bell curve, most people are usually abnormally low or abnormally high. And so when they check you, you're somewhere in between, okay? So the normal tests that they order are usually TSH and T4, all right? And so that really doesn't get deep enough to figure out what's going on. So a true thyroid functional test, you need TSH, T4, you need your free thyroxine index, free T4, T3, free T3, reverse T3, TPO and TBG antibodies for Hashimoto's disease, TSH antibodies for Graves' disease, and your thyroxine binding globulin levels. So you want to know about all of these, and that's a better test for thyroid. And so when we look at these 10 different tests, that's how we know we can manage all of these conditions, by knowing where the symptoms are coming from. So burning out the thyroid gland with hormone replacement is a 50-year-old model, okay? And so Hashimoto's disease is something that 70 to 80%, and in the literature, up to 90% of women with hypothyroidism have, and they have no idea, they've never heard about it, okay? These are not thyroid problems, okay? Your immune system is mistakenly attacking TPO or TBG for Hashimoto's, or TSH for Graves' disease, and Graves' disease is for hyperthyroid disease. These are immune system problems. There is an imbalance in your immune system that needs to be addressed, and it's addressed first primarily by figuring out what's wrong and proper testing. So why would your immune system be doing this? We have dysregulation of the system, right? Or you have an active antigen. So let's look into that. So you have chronic inflammation that can occur from bad blood sugar or dysglycemia, bad adrenal glands. So you've had stress, emotional, chemical, physical, traumatic stress. All of these conditions start at a certain time and for a certain reason based on things that have happened to you. All right? Dysregulation, hormonal imbalances. It could be pregnancy. So after your last child, you might have had some postpartum depression. Or there's a shift between the last trimester of pregnancy where you're Th2 dominant into Th1 dominance, which occurs postpartum after you've given birth. Neurologic imbalances within the brain that can cause these things. Or you could have an active antigen, which means you could have an infection, bacteria, a virus, mold. It could be a parasite within the gut that's causing it. It could be a sensitivity to a certain food, environmental toxins, which are all around us based on where we live in Louisiana. It could be undigested food, leaky gut syndrome that we're concerned with, and it could be bugs, protozoa, things like that, okay? There's 6 major thyroid patterns, and this is the problem with the present model, that they don't understand sometimes these different models of the thyroid. So number 1, you have primary hypothyroidism. So in primary hypothyroidism, the thyroid gland gets lazy and the pituitary gland tries to kick us in its pants by pumping extra TSH. So then you can get high TSH. It's the only pattern of the 6 where Synthroid or levothyroxine probably is going to work. Okay? Hashimoto's may need this as well. Now, number 2, you have hypothyroidism secondary to pituitary hypofunction. And what that means is the pituitary gets lazy, and usually your TSH is below 1.8, which is the medical endocrinology range. You have chronic stress, which fatigues that gland. So we all have stress, right? And so when we have chronic stress, it fatigues it. Hormone pills, including Synthroid, could cause it. Creams with estrogen can cause it. And who's famous for having creams with estrogen that struggle with her weight and her thyroids? Oprah. Oprah made these creams, and she had estrogen within those creams, and she struggled. She would get thin, and then she would become overweight. And she would get thin, and she would go overweight. So you have to realize that some of these anti-aging creams and some of these things that you're taking can be affecting you and giving you some of the problems that you're having. Postpartum depression and the pregnancy can fatigue the pituitary gland, and of course fluctuating insulin glucose levels. So number 3, thyroid underconversion. The thyroid gland isn't making enough T4, but there is a decrease in conversion of T4 to T3. Why? Because of chronic adrenal stress, chronic infection or inflammation. Number 4, thyroid overconversion and decreased thyroxine binding globulin. Too much active T3 is being made, which is overwhelming the cells, with too little TBG, which means too much free T3. So TBG is basically like your taxi cab. The T3 needs to get inside the taxi cab so that it can take you to where you need to go. Problem is this is kind of like how you'd be in New York City. There's not enough taxis and enough people standing in the corner trying to hail them down, right? So number 5, thyroid binding globulin elevation, too much TBG in the blood, and thus far too little T3. Why? This can occur from oral contraceptives, so birth control, or estrogen replacement therapy causes an increase in estrogen, which leads to an increased TBG. And the last one is called thyroid resistance. The pituitary and thyroid glands are fine. They're completely fine. Hormone levels are fine. Labs look good. However, the hormones aren't getting inside the cell, and we talked about is T3 needs to get inside every single cell, just like insulin and glucose. So what's happening is you're getting a chronic stress response, which stimulates the adrenal glands, which of course sit on top of the kidneys. They release too much cortisol, which is your stress hormone, which causes the cells to become resistant to thyroid hormones. So what do we need to do? For thyroid dysfunction, we have when we check the signs of metabolic dysfunction, proper testing is crucial. So complete metabolic profile includes complete thyroid panel, including thyroid antibodies, vitamin D levels, anemia, and kidney function. We need to do immune imbalance tests for the Th1 and the Th2 sides of your immune system. And what that means is this. The Th1 part of your immune system is what fights viruses, the bacteria, the flu, bugs. The Th2 side is your humoral response, and the Th2 side is what tags cells to be destroyed. We need to check the adrenal glands, we need to check for food sensitivities, and of course we need to check for any gut infections, parasites, or yeast. So we want to do a comprehensive neurologic workup where we look at blood pressures, oxygen saturation, tissue perfusion, heart rate and rhythm, saliva pH, reflexes, eye tests, cranial nerve tests, and cerebellar tests. We want a metabolic test, blood sugar levels, adrenal function, cortisol levels, thyroid hormone, cerebellar antibodies, thyroid antibodies, female hormone panels, GI permeability tests, and immune panels. Okay? So how does this happen? Very simply, stress. Emotional, chemical, physical, and traumatic stress. So physical, tension and trauma. Chemical, toxins can lead to poor thyroid function. And emotional, mental, emotional stress causes cortisol release. So stress causes a decrease in the brain's frequency of firing. So how do we correct symptoms without medication? We correct neurologic imbalances with brain-based therapy. We correct fatigue with PEMF or cellular exercise. We decrease immune system inflammation. We increase regulation of blood sugar and adrenal function. We decrease any opportunistic infection, and we regulate any hormonal imbalances. So on your next visit, you're going to be required to bring your spouse or significant other if you have one. We're going to go over your neurologic exam, your x-ray or MRI findings if you have any. We're going to go over any pertinent lab work. I'm going to explain to you what's wrong with you, what we're going to do to help you, if you're a good candidate for what we do, how long it's going to take, and how much it's going to cost. We're going to review what your investment in your health is going to be. We're going to review what your insurance covers, what it doesn't cover. Certain procedures that we do, of course, are not covered by insurance. Come prepared to make a financial decision and be ready to begin care if we accept you into our program. On your next visit, after we've discussed whether you're a candidate or not, my case manager will go over with you my treatment plan, and she's going to go over how many visits that we think you need. We go from any basic visits from 12 visits all the way to 24, 36, or 72, depending on how bad your condition is. And we always try to find a way to make treatment affordable for all patients. Review our success before you come in. All right, so I want everybody, before you come in, I want you to go to youtube.com. When you go to youtube.com, I want you to type in recovery physical medicine, all one word. There's hundreds of testimonials on that site. Hundreds, all right, of thyroid conditions, diabetes, pain, of all kinds of different conditions. Because we know a lot of patients are skeptical. They're like, well, I've gone to my doctor. He's the best at what he does. How can you fix me when they can't? Sometimes it's best to hear from people that have been in your same shoes. And once you hear how many people have improved and their lives have been changed, it gives you a kind of comfort. Well, I'm glad that you enjoyed this DVD, and we look forward to seeing you on your next visit.